So in this video, we're going to continue our discussion of cardiovascular integration or integrated cardiovascular. And we want to just review real quick the three main things that we discuss in this integration is changes in gravitational force, exercise, and hemorrhage. This video will focus on exercise. Just a quick recap from last video about the gravitational force when we move from a supine position into standing is we have blood pooling in the venous system, then the arterial pressure is decreased, therefore we have a compensatory mechanism of the baroreceptor reflex, which increases the sympathetic outflow doing three things. On the heart, increases heart rate contractility and cardiac output. On the second thing, arterioles, it constricts arterioles, increasing total peripheral resistance. Then the last thing, last compensation is constricting the vein, which increases venous return. Those three things of the heart, arterioles, and veins, that will bring our arterial pressure back up to normal. Now let's talk about exercise. Okay, our patients, we encourage them to exercise all the time, and we need to know how exercise works. Okay, and in order to jump into this subject, we're just dividing it into two things. There's something called, and when we talk about exercise related to cardiovascular, or central command, which is anticipation of exercise, and two is increase in metabolic activity of the skeletal muscles due to exercise. Okay, for the central command, it originates in the motor cortex or from reflexes initiated in muscles proprioceptor when the exercise is anticipated. Okay, so here's what initiates it, or initiates the following changes when we anticipate exercise. So there's 5 topics here. I apologize. There's 5 topics which we'll be discussing. First one is the sympathetic outflow to the heart. Okay, the sympathetic flow to the heart and blood vessels is increased. Okay, and at the same time as the parasympathetic outflow to the heart is decreased when we have anticipation for exercise. As a result, the heart rate and the contractility stroke volume are increased, and the unstressed volume is decreased. Right. Now, the second thing with anticipation of exercise is that cardiac output is increased. Okay. The cardiac output is increased primarily as a result of the increased heart rate, which we talked about with and knowing the equation of cardiac output equals heart rate times stroke volume. And to the lesser extent, we have a little bit of increased stroke volume. But the main thing is increased heart rate. The third thing here, which I have is on the list, is the venous return increasing in anticipation of exercise. And that is as a result of muscular activity and venoconstriction. Okay, when we have increased venous return, it provides more blood for each stroke volume, and that's with the Frank-Starling relationship that we talked about before. Finally, another last point that we want to talk about in the central command or anticipation of exercise is arterial resistance in the skin, and also we have the arterial resistance in the splanchnic regions, in the kidneys, and in active muscles is increased. Okay, so the arterial resistance overall is increased in the skin, splanchnic regions, kidneys, and in active muscles. Okay, accordingly, in this when this happens, the blood flow to these organs is decreased. Okay, the second and the last point I want to talk about with the exercise related to cardiovascular integration is increase in metabolic activity of skeletal muscles. Okay. Vasodilator metabolites, which I have here listed such as lactose, potassium, and adenosine, they accumulate because of increased metabolism of the exercising muscles. Okay, so these metabolites, as we talked about in previous videos, they cause arteriolar dilation in the active skeletal muscles, which increases skeletal muscle blood flow. Okay, so when we have these metabolites, we have arterial dilation, which leads to increased skeletal muscle blood flow, or what we called quote-unquote active hyperemia. As a result of the increased blood flow, O2 delivery to the muscle is increased, which is what we need when we're exercising. The number of perfused capillaries is increased, so that the diffusion distance for the O2 is decreased. Okay. Now, this vasodilation accounts for the overall, what I have listed here, overall decrease in total peripheral resistance. Okay, vasodilation leads to overall reduction in the total peripheral resistance. And this occurs with exercise. A note to be made that activation of the sympathetic nervous system alone by the central command would cause an increase in total peripheral resistance. Okay, so if only the central command is in action, then we have an increase in total peripheral resistance. But when we start having metabolic activities or metabolites such as lactose, potassium, and adenosine, then that's when we see a decrease in total peripheral resistance. And it's important to know the distinction between those two. Okay, let's sum it up in a figure. Exercise. We divided it into central command and local responses. When we talked about the central command, we mentioned that we have increased sympathetic outflow and decreased parasympathetic outflow. Why is that important? Because we have increased heart rate, contractility, cardiac output. Okay, we have constriction of arterioles and then also constriction of veins. Some of the arterioles are constricted by central command, are the splanchnicus and renals, and the constriction of veins leads to increase in venous return. What does that do? It increases overall blood flow to the skeletal muscles, which is what we need when these two lovely birds are running. That's what they need. They need blood flow to the skeletal muscles to keep running together and talk about their love story. Okay, now the other thing that was important for exercise is local responses. In local responses, we have increased in vasodilator metabolites, which I harped on over and over about, such as potassium, lactate, and adenosine, and this leads to dilation of skeletal muscle arterioles, which decreases total peripheral resistance. And we compared it to the central command, we would have increased total peripheral resistance. And summarizing all of this for you that love tables, we have heart rate, stroke volume, and cardiac output, arterial pressure and pulse pressure increase due to exercise. Total peripheral resistance decreases, and that's due to vasodilation of skeletal muscles, and the atriovenous O2 difference increases, and that's due to increased O2 consumption. Okay, I hope this was helpful. Please leave me comments, and we'll see you next video.